Foam rolling your legs. Front side. Very important to get from the knee to the hip crease so you can get the whole works. Same thing on the side. Also very important to do both the front and the side. This can be helpful for everything from back pain, hip flexor tension, knee pain, and just generally tiredness in your legs, among other things. My favorite technique is make sure that you always take time to breathe and sink into the roller. That's crucial. Then it won't take as long to get the results you're looking for. You may do it methodically, starting from top to bottom, bottom to top. The other important thing when you're foam rolling is to keep your upper body still and stable. Don't let your back arch. Don't let your shoulders scrunch. Press your forearms into the ground and let the ground help support you. Keep your belly tension on just a little bit. Do not hold your breath. Roll down until you're on the tops of your thighs, just above the crease in your leg. Put most of the weight into the side that you're working on. Maybe it's the left side. Then just gently start to bend and allow your leg to straighten. It's helpful to keep your body sinking into the roller, deeper and deeper, spreading those leg muscles out as the weight of your body does most of the work for you. Big breath in and breath out. Roll to the next section of your leg and do that again. Pretend like somebody else is bending your leg, that your leg is so heavy you can't even do it yourself. What you don't want to do is raise up off of the roller in any way. You want to just keep your body weight sinking, 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 even as you do these little movements. The movement plus the pressure will help the muscles release. You're going to roll to the next section, the next section, and the next section until you get to the other end of your leg. Here it's my knee, the top of your knee. You do not want to put the pressure on your kneecap or below your knee, just right above. Keeping your back still, not arched. Little mini bends. Somebody else is doing the work. And you want to do each section basically until you feel a change, until you feel some spreading out, some softening, some pain relief, some tension relief, or until you just can't take it anymore and take a break and move on. The second area to do is the side leg. This will be much more uncomfortable, and it is normal for this to be more uncomfortable, but the more you do this, the less uncomfortable it gets. You can prevent the pain. Don't wait until you have a problem. You're going to lie on your side, so going from your forearms to one forearm and one hand. Let these support you and press the floor away. And the top leg can also support you too. You can either use the side foot with a bent knee or the bottom foot, and gently settle your weight down into the roller. Everything from where the bony part of your hip is there, even above where the meat of your hips are, is a nice place to do the foam roller. You'll hit that little bumpy part of your hip joint, your leg bone, your femur. That's called the greater trochanter. As you roll over that, that'll be really uncomfortable. So just get slightly below that little bump of the hip. And then let that bottom leg relax and be heavy and do sinking in. Take a few breaths. Let as much of your body weight sink into the roller as you can bear. Take some off by pressing up with your hand, your forearm, your foot, and just hanging out there. To keep your neck from getting sore, tuck your chin. Really elongate your head is what you're doing. Let your head be long. Then go down to the next section. The further down your leg that you go, the more painful this will be. If you do it every day or regularly, it won't be this painful, I promise you. Just do it as long as you can tolerate it. You can do little mini rolls. But if you're doing the roll, make sure you're not lifting up off of the roller. Sinking, sinking, sinking. Please do not push into the roller. When you push your body into something, it pushes back and it tends to give you more tension. Sink. The most painful spot will be when you get down closer to the bottom part of your knee. Just know this. Leg is extended on the bottom. The top leg can be bent. You're really supporting yourself strongly with your upper body and maybe even your top foot. Then sink down into it. Little mini rolls until you feel a change. Good luck with this. If you have questions, please ask.